Okay, so for many women, facing their 50s is really a scary thing, but it doesn't have to be. You know, they think, oh, my face is starting to look different and all this stuff. Well, Dr. Lydia Parker has some amazing non-surgical ways to kind of go about embracing your 50s. So listen up, ladies. And one of our very own here at Channel 3, Leslie Pastel, she is gung-ho, facing the 50s and going at it strong on a journey that we're going to share with you. Take a look.
The biggest thing is this line and indentation here, and then also I've got one here, and then the jowls. I feel like sometimes I look and I just look tired and droopy, and then I've got, you know, some sun damage. I try, you know, I wear the sunscreen, but I'm a boater. We're out on the water all the time.
So much we can do today. There's so much new technology, and even with our liquid facelift concept, where we can basically, with some injectables, make someone look lifted, refreshed, take away some lines, firm, without any surgery at all. Everyone wants to look better, but they're busy, they're working. They can't take 2 weeks off of work. They need to do something where they can, you know, be a little pink and puffy over the weekend and back to work on Monday. They need to do something where they can put some makeup on and run right back to the office, right out of the doctor's office. So all that consumer demand has really been great for pushing new technology where we can non-surgically rejuvenate our faces with a little lunchtime or over the weekend procedure. Yeah, okay. You want to firm all this up, and it's going to make this look better. But, you know, anything you do up here is going to pick up on everything below and make everything look better. Okay, so you've had the numbing cream on for a little bit, and you'll still feel the injections with the numbing cream, but it takes the edge off a little bit. It makes it a little easier. And ice for her, Carrie. And we like to ice the areas too, because that helps you to feel it a little bit less, but it also helps you to bruise less too. So anytime we treat you with a needle, you can get a bruise. I'm going to start between the brows. Now, the Botox, if you've never had it before, it's good to know that the Botox does not go in the lines. It goes in the muscles that make the lines. You okay with that? So sometimes people who've never had it before think, oh no, that's not where I wanted it. Because they think it needs to go in the wrinkle. It doesn't go in the wrinkle. So we'll want to reduce your forehead lines, but we don't want to make them all go away 100%. Too much Botox in the forehead might lower your brows, and we don't want that. If anything, we just want to lift your brows. Now, you mentioned these lines. We'll go ahead and treat there. This is going to firm up the jowl area for you too, okay? The filler injections just take maybe 10-15 minutes to do. And the side effect that we expect that most everyone would get, really the only side effect, is some bruising. Most people will have a little bruise or two somewhere that requires a little makeup, a little extra makeup for a week. You know, I always say, this is my canvas, this is my paintbrush. You can give 10 injectors the same syringe, and you're not going to get the same result. You know, there definitely is some artistry involved. For further improvement, we'll want to start doing things to grow and build this collagen here
and to
firm you up, and treating all through here now. We haven't done anything there today, but treating through here will lift you, and this will look even better once we get going on that.
Yeah, but it's already a difference. Awesome. Thank you.
You're welcome.
Aw, isn't that great? Leslie, thank you for all that you're doing. And of course, Dr. Lydia Parker, you too. The Parker Skin and Aesthetic Center in Beechwood is at 216-464-7333. And their Willoughby location is 440-946-9080. Also, theparkerclinic.com. Next week, Dr. Parker is going to show you how you can actually use an injectable called Sculpta that will help you look like you had a facelift without surgery. So if you're close to your 50s or in your 50s, see that? Okay.